Hello everyone, Dr.Mungli here. In this video, I will be doing a high-yield review on vitamin K. Now the vitamin K, it is of three types. Vitamin K1 and vitamin K1 is called as phylloquinone. And phylloquinone we get it from spinach. This is any greens. They are rich in vitamin K1, green leafy vegetable. In that, I would like to give a special mention on spinach. Spinach is the richest source of vitamin K1, that is phylloquinone. Now vitamin K2. Vitamin K2 is referred as menaquinone. And menaquinone basically we get it from animal source. Vitamin K2 is from animal source, and especially this comes from bacterial flora. Bacterial flora in the intestine. Then we have, that's a significant source of vitamin K2 for us. Now vitamin K3. Vitamin K3 is referred as menadione. And this is basically a synthetic form of vitamin K. So these are three types of vitamins and their sources. So just to quickly revise that, vitamin K1 is phylloquinone, vitamin K2 is menaquinone, and vitamin K3 is menadione. Vitamin K1 coming from plant source, and that's green leafy vegetables, richest source of vitamin K1, especially spinach. Vitamin K2 is coming from animal source, especially from the bacterial flora in the intestine. K3 is a synthetic form of vitamin K. And also note that K is for coagulation. Vitamin K for coagulation, because one of the important function of vitamin K is coagulation. Now let's move on to see the functions of vitamins. Now functions of vitamin K. One of the main function of vitamin K is it is going to do the gamma carboxylation. So vitamin K functions, it lies in post-translational gamma carboxylation. Post-translational gamma carboxylation. So let me explain you what exactly is the post-translational gamma carboxylation. So I will write the polypeptide chain here, and you have amino acid which is attached with alpha carbon, and that is the carboxyl group and amino group, primary carboxyl, primary amino group. Then we have CH2, that is a beta carbon, another CH2, so that's a gamma carbon which is attached with COO minus. This is the glutamate, amino acid glutamate. Now the post-translational gamma carboxylation of glutamate residue, post-translational carboxylation of glutamate, amino acid glutamate. Now how the post-translation gamma carboxylation occurs? Now this is the polypeptide chain which has got glutamate here, and to that glutamate there will be addition of one more carboxyl group attached, COO minus, and this carboxyl group, it comes from carbon dioxide, and that carbon dioxide, so basically the carbon dioxide is incorporated into glutamate, adding as additional carboxyl group. This will be done by enzyme, that is vitamin K dependent carboxylase. Vitamin K dependent carboxylase enzyme. And this vitamin K dependent carboxylase is a ligase class of enzyme. It's going to use carbon dioxide and add it on to the gamma carbon of glutamate. This is the gamma carbon of glutamate, and additional carboxyl group is added. So idea here is to increase the negative charges on the molecule. Thereby these negative charges can interact with the positively charged ions. Now let's move on to see what all the proteins that are utilizing this post-translational gamma carboxylation of glutamates, which is mediated by vitamin K dependent carboxylase enzyme. Now the examples for proteins which are involved in post-translational gamma carboxylation of glutamates, and that is factor 2, 7, 9, 10. Clotting factor, these are basically clotting factors. Clotting factors 2, that is prothrombin, and 7, 9, 2, 7, 9 and 10. These are the clotting factors which are synthesized in the liver and they need to be activated. Note that clotting factors, they will be there in their inactive form and they need post-translational gamma carboxylation to be activated. So these clotting factors which are in zymogens are precursors of clotting factors. So the clotting factor 2, 7, 9, 10, they need vitamin K dependent carboxylase for the activation process. Thereby they can interact with calcium because two negative charges in the glutamate can interact with calcium, and calcium can interact with the phospholipid present over the platelet membrane. Thereby platelet aggregation can occur and can lead to clotting. This is how the clotting mechanism is activated, and for all that you need vitamin K dependent carboxylase action to convert zymogens into active clotting factors by post-translational gamma carboxylation. That's the main function of vitamin K. Now, in recent times, other functions of vitamin K have been studied, and so there is so much research that went on that, and that particular protein which is needing vitamin K dependent gamma carboxylation is osteocalcin. Note that this osteocalcin, it is a protein which is there in the blood, and also it will be synthesized and it is secreted by osteoblasts. So osteoblastic cells, osteoblasts, these are the cells which are responsible for formation of the bone. So these osteoblasts, they synthesize and secrete osteocalcin, and also this osteocalcin needs post-translational gamma carboxylation of its glutamate residues, and thereby it will be activated and it will bind with calcium, and that calcium will be provided for a hydroxyapatite crystal formation during bone formation. So bone formation or the bone density is directly proportional to the amount of vitamin K that is present in our body. Whenever vitamin K is available abundantly, and during that time vitamin K is diverted into osteocalcin activation. If the vitamin K is just sufficiently available or available in a normal range, so that can be used to activate clotting factors. So this is what is the function of vitamin K. Other function, it is participating in bone growth and development and bone health overall. Now another protein that needs vitamin K dependent carboxylation is protein C and protein S. Protein C and protein S. These are the proteins which are expressed over endothelial cells, and also it is present in the blood. So protein C and protein S, so what they are basically anticoagulation factors. This is something contrast here. These are anticoagulation factors, anticoagulation, and also they participate in apoptosis, and they participate in inflammatory process, inflammation. So activation of protein C and protein S, they need post-translational gamma carboxylation, and thereby they participate in anticoagulation, apoptosis, and inflammation process. So defect or deficiency in protein C and protein S, it leads to venous thrombosis, decrease in apoptosis, and also increase in the inflammatory process. So that is why we need to have vitamin K sufficiently, so that coagulation, anticoagulation, all these things will be kept in check. So that's another the function of vitamin K. So that is protein C and protein S activation. Then another function of vitamin K is it is needed for activation of proteins called matrix GLA proteins. These matrix GLA proteins, these are proteins expressed over endothelium, and they will interact with calcium, and basically they prevent calcification or mineralization of vasculature. So calcification of vessels, calcification of vasculature, and thereby it prevents atherosclerosis. So these are some of the, and also neuronal function of vitamin K. Vitamin K is participating in the neuronal metabolism that has been also studied. Now let me enumerate all the functions of vitamin K. So the first and most important function is activation of clotting factors 2, 7, 9, 10, and then activation of osteocalcin in the osteoblast, and it participates in bone health. It is needed for activation of protein C and protein S, thereby they participate in anticoagulation, apoptosis and inflammation, and it is participating in the activation of matrix GLA proteins, thereby it prevents calcification of vasculature, thereby preventing atherosclerosis. Now let's move on to see causes for deficiency in neonate. Causes for deficiency in neonatal period. During neonatal period, so why there will be deficiency of vitamin K? So the neonates, they will be deficient in vitamin K generally because of the low fat stores of vitamin K in neonates, and their intestine is sterile. So sterility of intestine because the bacteria not yet developed to synthesize vitamin K. And vitamin K is generally deficient in neonate because of poor transplacental transport. Poor transplacental transport of vitamin K. Note that out of all fat soluble vitamins, vitamin K and vitamin D is transported poorly across the placenta, so that there can be a deficiency of vitamin D and vitamin K. That is why, and also these are the two vitamins which are low in breast milk, vitamin K and vitamin D. So remember that. So that is the low fat stores, then sterility of intestine, poor transplacental transport. These are the things that can put a neonate at risk of vitamin K deficiency, and that can give rise to hemorrhagic disease of newborn. Name of the disorder because of vitamin K deficiency in neonate is called as hemorrhagic disease of newborn. So in this particular disorder, so there will be bleeding after birth, so especially intracranial bleeding in the gastrointestinal tract, bleeding from the placenta like umbilical cord. All these things can increase mortality rate in neonate. And the treatment for this is we give intramuscular injection of vitamin K around 0.5 milligram to 1 milligram intramuscularly. So it is given prophylactically to all the babies, newborn babies, just to prevent hemorrhagic disease of newborn. Now let's move on to see causes of vitamin K deficiency in adults. So vitamin K deficiency, from dietary causes of vitamin K deficiency is very less, so because majority of time it is available in most of the food stuff, and also it is significantly synthesized in the intestine by the intestinal bacterial flora. So dietary vitamin K deficiency is very, very rare. But then why we will see vitamin K deficiency in adults? And that's because of secondary to a disease like cystic fibrosis. Patients with cystic fibrosis, so they will have a defect in the exocrine pancreas, so digestive enzymes are not coming into the duodenum, especially lipid digestive enzymes. If they are deficient, that will lead to lipid malabsorption, and if there is a lipid malabsorption, so all fat soluble vitamins can be deficient. Now, it can be seen in any intestinal disorders, intestinal diseases like inflammation of the intestine, like Crohn's disease, tropical sprue, bacterial overgrowth syndrome. That kind of disorders can lead to vitamin K deficiency. Vitamin K deficiency in adults can be seen in biliary insufficiency. Biliary insufficiency is like if there is an obstruction in the common bile duct, so flow of bile into the duodenum, it will be insufficient. That will lead to lipid malabsorption, and that can give rise to vitamin K deficiency in adults. It can be because of a disease called A-beta lipoproteinemia. A-beta lipoproteinemia is because of a defect in a protein called MTP, microsomal transfer protein. So because of this particular deficiency or defect in this protein leads to decrease or absence of chylomicron formation. Absence of chylomicrons, so it means vitamin K, ADEK along with fats will be malabsorption will be seen here, so that can give rise to vitamin K deficiency. A-beta lipoproteinemia is one of the cause for vitamin K deficiency. So vitamin K deficiency can be seen in people taking broad spectrum antibiotics. Broad spectrum antibiotics, they kill the bacterial flora, so thereby vitamin K synthesis is decreased. So that's an understandable cause there. So if somebody using broad spectrum antibiotics for long periods, so that can give rise to vitamin K deficiency in them. And anticonvulsants. Anticonvulsants, they interfere with the absorption of vitamin K in the intestine, thereby they can be a risk of leading to vitamin K deficiency in these patients who will be taking anticonvulsants. So these are the causes of vitamin K deficiency in adults. So we have cystic fibrosis, intestinal disorders, biliary insufficiencies, A-beta lipoproteinemia, broad spectrum antibiotics consumption, anticonvulsants uses. Now, what are the signs and symptoms that you are going to see in vitamin K deficiency? So the disorder here, vitamin K deficiency disease manifestation. So disease manifestation, it is all about bleeding. So vitamin K deficiency will lead to increase in prothrombin time. Increase in prothrombin time because activation of prothrombin, that is clotting factor 2, it needs vitamin K dependent carboxylation process. So when the vitamin K is deficient, so all these clotting factors are not activated. Because of this, so time taken for clotting factors to be activated is prolonged, and that will lead to increase in bleeding, increase in the risk of bleeding process. So risk of bleeding. So for any trivial event, so there can be a bleeding going on and it will take longer than the normal time to clot. So that is the risk. So bleeding can go on in anywhere. It can be intracranial bleeding, cerebral vasculature can bleed, can be gastrointestinal bleeding or bleeding within the joints. So it is all overall bleeding disorder here in vitamin K deficiency. And how to differentiate this vitamins from vitamin C deficiency? So you need to look for prothrombin time. So the prothrombin time will be prolonged in vitamin K deficiency, and in vitamin C deficiency, prothrombin time it will be normal. Okay. So what is the treatment? So once you identify vitamin K deficiency, so we really need to supplement with vitamin K with intramuscular injection of vitamin K can be given here. So this is all about high yield review about vitamin K here. So I hope this video has helped you in reviewing vitamin K in a short time and all the high yield points covered here. So make sure you note all the functions of vitamin K, especially the new functions of vitamin K other than clotting mechanism, And causes for vitamin K deficiency is one of the must thing that you should know, because that's how the K stems are made when the questions are asked. That's about it. Thanks for watching, and see you in my next video. Take care.